It was like a scene from the halcyon days of Studio 54, the legendary New York City discotheque where often only A-listers, name-droppers and the well-connected were allowed inside. When word leaked out last month that Southern California Hospital in Culver City would share its extra doses of the Pfizer-BioNTech vaccine over 3 days with the local medical community, frontline workers flocked to the 450-bed facility. What they found when they got there was troubling. Long lines of people, both young and old, snaked through the hospital. Some medical workers reported being turned away by security guards who instead allowed hospital employees to escort family members inside, where they received the vaccine that isn't readily available to most Californians. It seemed to be less about what you did for a living and more of who you knew to obtain a vaccine, said Katie Brockert, a home health physical therapist who went to the hospital 3 times but was denied a vaccine on each occasion. California Department of Public Health guidelines for distribution were not being adhered to, and those who have direct risk of exposure were being pushed aside because family members of Southern California Hospital were being prioritized and favored. Southern California Hospital officials did not respond to repeated requests for comment regarding the allegations. However, in an email last week, hospital spokeswoman Laura M. Gilbert said relatives of staff members were not invited to the facility for vaccinations. Southern California Hospital received more COVID-19 vaccines than needed for its employees and, to prevent them from going to waste, offered them to physicians who treat patients at the facility as well as police officers, firefighters, emergency medical personnel and public service employees, she said. One doctor, who asked not to be identified, said she learned from a friend on December 23 that vaccines were available through a physician at Southern California Hospital. The physician had let close friends know that he had extra doses available and to use his name to get in, and also gave his phone number, the doctor said. The doctor, clad in surgical scrubs, went to the hospital about 8 a.m. The next day, approached 2 security guards outside the front entrance and asked permission to go inside. They denied her request, saying the vaccines were only for employees. The doctor then appealed to a hospital employee in a white lab coat who had been standing near the security guards, and mentioned the name of the physician who originally offered the extra vaccine doses. He made me wait for 10 minutes while deciding my fate, the doctor said, likening the scrutiny from the man in the coat to that given to partygoers trying to enter Studio 54. He was like the bouncer at the club deciding if I was pretty enough to get in. Things became even more strange for the doctor once inside the hospital.